Yes, good morning, good afternoon, and good evening to you all. Welcome to this is June 2023, Waste Management Sub-Community of Practice Eco Session. It's been a few months since we had our last one. So I'm happy we are here. As we had promised earlier on, we are reviving this sub-community of practice to continue moving forward this important subject on waste management. We know we have raised as much awareness as possible, but this is not enough. We continue to face the challenges with regards to waste management. And today we want to talk about an important subject when we speak about waste. Of course, much of the group here is coming from the laboratory background, and we know we use a lot of chemicals and that bring a lot of hazards with them, such that they deserve, we feel, one focused discussion like we will have today. And the more we continue with testing, the greater the harm and the challenge that we do face. So to do this, we have brought colleagues from the UK Security Agency, UK Health Security Agency, to speak about what is it that we should watch out for when we deal with most of these chemicals in order to prevent hazards and protect the health of everyone involved. So this session, is advertised, will introduce much of the principles that we need to look out for, including risk assessments. We talk about toxicology, the common scenarios where chemical hazards can result in public health emergencies. And we actually look at elements and some of the practices that we can do to make sure that we limit the impact of such hazards. And to do that, we have brought one of the many experts that we have behind him in the name Nicholas Brooke, who is the principal environmental public health scientist for chemicals and chemical poisons at the UK Security Agency. And I would like to acknowledge the joint work that is being done via Africa CDC and the UK security agents in this important manner for us to have this session today. I would like to remind all of you that, as usual, we have our interpretation in both French and Portuguese. Please choose the language of your choice. Do not remain on the original audio. Just make sure you choose one of the subject, French, English, or Portuguese. We will have about 20 minutes to 30 marks of the presentation, followed by the question and answer segment, where we'll be able to address many of the questions that come through. Please do not worry about introducing yourself in the chat, as we have been able to capture your name as you are entering in this session. So without further ado, I would like to call upon Nicholas to take us through our presentation today.
Thank you very much, Anafi, and thanks very much for the introduction. Yes, so my name is Nicholas Brooke. I'm a toxicologist working as a principal environmental public health scientist in the Chemicals and Poisons Department of the UK Health Security Agency. And basically today I'm going to give a quick overview of the general principles of chemical hazards and public health. With myself and Lydia Online and a number of other colleagues work in international capacity building. So this is like a bit of a standard intro presentation with a bit more focus on waste, basically, as that's been requested as a particular area of concern. There will be a number of interactive sessions, so but they'll be clearly marked as we go through the presentation. Okay, so we're going to quickly give an introduction to chemical hazard. This is the content of the presentation today. We're going to give a quick introduction to chemical hazards and what the problem is. We're going to talk a little bit about international regulations that apply to capacity building, including some of the mechanisms that can be used and the key indicators developed by numerous agencies, including the World Health Organization. We're going to look at identifying the problem. We're going to look at what waste issues you guys come up with as part of your roles. And we're also going to have a few slides on how we prevent and prepare to chemical incidents. And just to say, there'll be a number of interactive questions as we go through. We do like to keep these as interactive as possible. So we'll give a minute or two for people to answer each question, and the slides will be clearly marked with question at the top. And just to say, it's not a test, it's just to help us increase our understanding of how we understand Africa region. Okay, so first slide here. Why is it important to prevent chemical releases? You can see a number of different pictures here of different areas of contamination of different areas. You can see on the top left, there's an industrial site there after a fire that can create lots of dioxins, burning of products of combustion, which can produce pollution to the air and the associated land. Top right there, we can see a farmer spraying pesticides. From our work in Africa already, we understand that exposure to pesticides can be a problem. You can see here this farmer isn't wearing a great deal of personal protective equipment, such as a suitable mask or gloves. Pesticides can also be a problem from a self-harm perspective, actually. Quite often we find that when people want to deliberately harm themselves and take an intentional overdose, often pesticides are something that is chosen from that perspective that can cause numerous public health issues. Bottom left picture, you can see somebody swimming in some water, and I don't think you need me to tell you that that water is likely to be very contaminated, as well as biological agents. There's a lot of chemical waste there, could result in things like hydrocarbons, oil, everything that person could be exposed to. And on the bottom right there, this is showing some waste that hasn't been looked after appropriately. You can see a number of barrels leaking. That's contaminated nearby water, and there's a big slick coming out there. So just to give you an idea of what we're looking to talk about today. So, why are chemicals important? Chemicals are an essential component of our lives. If we don't have chemicals, we won't live. We have to have essential nutrients such as iron, magnesium, vitamins, those kind of things. And so a number of chemicals are essential. They're part of a lot of drugs, they're part of a lot of cleaning things, and obviously cleaning is quite important. And obviously pesticides even can be to have a positive impact in some areas whereby they allow crops to develop and the African and world food production to remain stable. However, some chemicals can severely damage our health and or the environment. Some are more toxic, some are more persistent than others. Things like DDT, they stay around in the environment for years. They can get into the soil and stay there without remediation for hundreds of years. And also they can get into people's blood, cause cancer, and cause other long-term health effects, including reproductive and immunological problems. There's over 50 million known chemicals. There's a CAS registry which registers all of the chemicals, but only 70,000 of these are generally in common use. Of these 70,000, there's been appropriate and detailed toxicity data for only a few hundred. That's where there's been enough evidence in humans or human exposures, or from epidemiological studies, or even studies on animals to say, how safe a chemical is likely to be. So there's a lot of unknowns. And on top of that, there's 200 to 1,000 new compounds produced per year in a wide range of areas, such as industry, farming, as part of food production, which are all very important. And the WHO, the most recent estimates state that over 13 million deaths could be prevented each year by addressing environmental problems such as air and water pollution. air pollution is a big problem from traffic, but also from industrial sources. And we also have to think about chemical accidents where chemicals are released into the air there. And obviously water pollution can be a big issue as well. Chemicals like lead, arsenic. And this is just giving an idea of the next slide is giving an idea of, the impact of chemicals. 3.6% of all death worldwide is attributable to chemical exposure, and that equivalent of 2.1% of disability adjusted life years impact as well. I won't go into these in a lot of detail, but on the left we have a diagram showing the 10 chemicals of public health concern as stated by the WHO. A lot of these will apply to Africa, but this is on a global level. You can see we've got hazardous pesticides, air pollution, cadmium, dioxins, inadequate or excess fluoride. Fluoride is a bit unusual in that you can have too little or too much of it, and both can cause health problems. Asbestos, which is found in building materials throughout the world. And just on the right there is a reference, which we can provide links to afterwards, which is a really good document produced by the WHO on chemicals of public health concern and their management specifically to the Africa region, so particularly relevant to the audience today. And we'll be showing a few figures from that as we go through the slides. Okay, so we've been asked to focus on waste today, and we've been working in countries in Africa for a number of years now, and waste production in Africa basically exceeds the available capacity for collection and disposal. And according to the United Nations Centre for Human Settlements, only 0.6% of solid waste is recovered and recycled. And also worth noting that industrial waste in liquid form is usually discharged into sewerage systems or rivers as effluent. White solid waste that was either dumped in landfill or pits within workplace premises. Also, something we've come across a lot is that there's often a lot of waste left in storage because people aren't sure what to do with it, and often there's not the resource or the local capability from private contractors to deal with that. Okay, so this is our first interactive question, and we'll give people 2 minutes to answer this. This is not a test, so what we'd like you to do is to type in the chat from your perspective, what are the issues with waste management from your perspective? So you should all be able to type in the meeting chat, and yeah, so we'll be, myself and my colleagues will be keeping an eye on the answers there. And I should say that if you have any questions throughout the presentation, please feel free to type them in the chat, and I'll be presenting, but my colleagues Sean and Lydia should be able to answer these as we go through. Okay, so I'll give everyone 2 minutes. Okay, so I'll just read a few out, and we've got your lack of appropriate treatment and disposal methods. Just discharge to sewer or drain is the norm. Lack of knowledge and lack of disposal opportunities. Good point there, waste segregation and disposal. We'll be coming on to a tool we're developing later, which should cover little bits of that. Lack of education. Explosion. Yeah, the fact there's no sufficient facilities to destroy dangerous chemicals. And quite often, in an ideal situation, countries would have a hazardous waste landfill or an incinerator to dispose of chemicals depending on their properties. So facilities are always very helpful. Poor knowledge, poor equipment and settings. Yeah, there's often technical limitations. And yes, we will be providing the PowerPoint presentation. can see some people have mentioned specific chemicals, waste disposal of cyanide and mercury, as well as biological waste. Very good. Thanks very much for all your interaction. We don't always get this many answers. Trying to pick out the ones that stand out that we haven't mentioned already. Yeah, MSDS is obviously, that's very important. We'll cover that under emergency preparedness later. Increased use of plastic and non-recyclable material. Okay, looks like we're getting a very very high number of responses there. I'll start moving on in the presentation now, but we will be keeping a record of all of these answers. And if anyone from the panel or from UKC wants to jump in and say anything on any of these, feel free. Okay, look, I'll move on to the next part of the presentation now. I realise we can't have a chance to answer every query, but we can come back to some at the end because we've got a lot of answers and we've got a lot of time, a lot of subjects to cover in the next hour. Okay, doke. I referred you to the WHO guidance on the chemicals of major public health concern in the WHO African region. And the main chemicals of concern identified, not just specific to waste, but in general, but a lot applied to waste are the following. So we've got heavy metals, mercury, lead, cadmium, arsenic, fluoride, cyanide, we mentioned already, air pollution, hazardous pesticides, particularly persistent ones like organic chlorines and persistent organic pollutants such as dioxins and furans and PCBs, and also benzene, which is found in fuel, and polycyclic aromatic hydrocarbons, again, which can be found in fuel and as combustion products. And the map on the left is showing, if you do have a chance to read the reference in more detail, it's showing how, based on the survey undertaken by WHO Afro, which chemicals are of particular concern in which countries, as there is some variation across Africa. Okay, so we've got another interactive session now. Okay, so after what you've learned already, and so we're particularly interested in chemicals which aren't listed already here in this list. They're the main ones identified for Africa. What are the key chemicals of concern, in your country from your perspective? And again, we'll give you a minute or two to type away in the chat, and we can pick a few out as we go through. Xylene. GTC. Could I ask what GTC stands for? I should know this.
Guanidine and thiocyanate.
Right. Okay. All right. Like phosphorus, yeah, that's a typical pesticide. Mercury. Guanidine, isocyanates. Yeah, isocyanates can be a problem. It can be used in a lot of spray garages for when spraying cars with new paints. Pesticides, lead, X-ray. Yeah, we're not covering radiation specifically today, but yeah, it's a very good point. That is an environmental pollution and exposure to radiation. And yeah, good point from pharmaceuticals. Some pharmaceuticals can cause, some major public health concern, especially if more hazardous pharmaceuticals are prescribed. I'll talk a little bit about poison centers later and their role, which can help with those. COVID-19 lab testing kits, that's an interesting one. Chlorine, yes, that's a big problem worldwide. Interesting that X-ray developing solutions have come up twice. GTC, I see what you mean. You're using this in the lab, that makes sense. antibiotics, that's a good one. Compressor on. Sodium hypochlorite, another chlorine source. Uranium, again, radiation is coming up to remember this. You know, and obviously reagent waste from labs. We've come across that quite a bit with, you know, lab waste has been difficult to, I suppose, I've yet first person to mention, well, first person I've spotted to mention carbon monoxide. That's one of the biggest killers. Tends to be, it seems colder countries where people are using boilers to heat their homes, and it can result in incomplete combustion. But we've come across numerous cases that of poisoning occurring indoors from cooking use in you know, warmer climates. Okay, we've got a lot of good examples there, and thanks very much for your interaction again. Again, we'll have opportunities for questions at the end of the presentation, but feel free to carry on posting there. Okay, so I'm just going to talk about international health regulations, mechanisms, and some of the references we refer to a lot. I won't go into these in a lot of detail, but it's good to be aware of them. You know, for countries to improve their capacity to respond to chemical events and other events, they have to comply with the international health regulations. That's the picture in the middle there with the green background. And there's WHO benchmarks to help assist countries to improve how they respond to chemical and other events. The Sustainable Development Goals report, there is not just chemicals, but has a lot of chemical input. The WHO have developed a chemicals roadmap, which has a lot of useful tools to help, you know, reduce risk of from chemicals by appropriate management, increasing institutional capacity, improved leadership and coordination. And another important reference there is a state party self-assessment annual reporting tool, where all countries are required to self-report their capacity in the chemicals area, maybe around whether they have appropriate plans in place, whether they have poison centres, or whether they have you know, sufficient laboratory capacity, for instance. Okay, so this is showing Annex 1, some of the core competencies concerning chemical incidents and emergencies. So this is from the International Health Regulations, and these are the things that should be in place to improve the management of chemicals within a country. That includes legislation appropriate for chemical emergency surveillance and response, a national chemical emergency coordinating structure. So that could be like a technical working group of chemical experts to deal with any issues in country, a surveillance system. When people are exposed to a chemical, is that reported to labs? Is it reported to health facilities? Is that then passed along to public health agencies to identify any, you know, major issues such as a mass poisoning or you know, chemical incident where people are presenting with similar symptoms? A national risk assessment on chemicals. That's part of the reason why we're asking you to list the chemicals of concern, you know, because it's very key to prioritize chemicals of concern across Africa and why. And there we got specialist advice on chemicals poisonings, and that can often be achieved via a establishment of a poison center. I know some countries on the call today have poison centers, but there's numerous countries in Africa which don't have poison centers, and they can give, it's like a big call. For those of you not aware, that's like a big call center where people can call where they've been exposed to chemicals, drugs, answering the query about pharmaceutical exposure earlier. So that can deal with intentional poisons such as overdoses, or even accidental poisonings where people have exposed themselves to a pesticide while at work, for instance. And also, it's important to have supplies for managing victims of larger scale chemical incidents. So for that, you might be looking at are there facilities in place to decontaminate patients who have been exposed to chemicals in hospitals? Are there antidotes available or sufficient medical equipment to treat those patients who have been exposed to chemicals in you know, large scale chemical incidents? And we're not going to talk too much about, you know, the work we're doing in the capacity building area, but we thought this one was quite relevant. We very recently started work on a project to help develop a waste management tool. This will be hopefully something we can adapt accordingly to the Africa region, and maybe even on a country-specific basis, depending on how our project goes. But basically, what we're hoping to do is to develop a tool which helps people, identify any issues with waste. We talked about segregation earlier. It could include things like that. Could look at potential disposal routes of waste. And you can see on the left there, this is a very draft version of a tool and what it might include, what remediation objectives are required. Are there final treatment and disposal options available, such as incinerators, hazardous landfills? Does the area need to be remediated that's been contaminated with this? All those kind of things. And then there's a step there around looking at what technical options are available. Is there any options available to treat the waste? Is it simply, or the only option is to burn waste? Are there incinerators available? Do countries have more advanced waste treatment facilities, such as anaerobic digestion? Quite often in Africa, I imagine that won't be the case, but it's all about creating a tool that can help point people in the right direction. And we've even got things in there about perform sustainability assessment, which, if we are going to treat waste or dispose of it, which ones are most appropriate to get a balance between environment, social and economic net benefit. And and then other steps on performing a detailed technology evaluation. So this is just something we have on our work plan over the next couple of years. So yeah, that's something we hope to take forward, as well as other chemical capacity initiatives. And these kind of things can be particularly useful. To put a picture on the right there of a number of poorly labeled or chemical containers. You can see they're all quite damaged. Some of their labels are damaged. Quite an issue we've come across in a number of countries is these chemicals being stored in areas such as underneath laboratories or other public buildings, and there's not appropriate, people don't know what's in them anymore, and then it causes a lot of problems with waste contractors then not wanting to deal with it because they don't know what they're dealing with, they're not sure what PP to use, all those kind of things. So we're hoping to develop a tool that can address some of these more practical issues. Just going back to the international health regulations, I've just included a few countries here, zoomed in a bit, and this contains a number of incidents which are thought to be of international public health significance, so it's not just likely to affect or with potential for it to affect other countries, not the only country where the waste was produced. For instance, there was an incident in Ivory Coast where waste was taken from one country, transported to Abidjan, and then dumped there, which resulted in 10 deaths and thousands being ill and required international assistance. So, example in China there, showing a plant explosion with 5 deaths, millions of people without water for several days as a secondary complication, and pollutants being released into a river, which then crossed international borders, which makes it, an incident of significant concern. And Panama, a diethylene glycol incident, which caused over 100 deaths, which I'll be talking about in a bit more detail shortly. Just going back to the WHO chemicals of public health concern and their management in Africa, there's a number of examples there, and only showing A to C there. There's an A to Z list, which is really good to look at, and there's a number of variety of things listed there, such as nitrate poisoning, lead poisoning, which I think is common across Africa, bromide poisoning, for instance, an incident there where table site was accidentally contaminated with sodium bromide, which resulted in a number of casualties. And then, for example, Botswana, there was methanol intoxication in students. That's often when when alcoholic drinks have normal ethanol substituted for methanol, which can cause problems. Aldicarb poisoning, which is a pesticide that was identified in Burundi, and a couple more pesticide poisonings in Cameroon, some of which led to fatality. So just to make you aware of these references, if you want to get a wider feel for what the issues might be in your particular countries. And as I said, there's a more detailed case study here about a Panama one, which was particularly nasty. Basically, a physician initially reported, so an A&E doctor reported an unusual number of patients with unexplained acute renal failure. They weren't sure what the cause was. They had abdominal symptoms such as nausea, vomiting, epigastric pain, and diarrhea before progressing to more significant kidney damage. And patients also exhibited a spectrum of neurological effects. All of these patients were treated symptomatically and supportively. They were put on dialysis, both to treat the kidney failure, but still 12 out of 21 of the patients who were dialyzed died, unfortunately. And this is just showing the pathway of the incident. So this incident, there were first cases picked up on the 9th of July, 2015. And you can see that some more cases were reported a couple of weeks later in July. So we had about 3 cases in July. But then there was a number of more cases, and it wasn't until the September, so we're looking at 3 or 4 months before, it was noted that there was an unusual number of patients with this toxidrome, as we call it, with unusual symptoms. Then it took another couple of months before assistance was requested by the Ministry of Health, and a case control study was initiated. And then the cause of the incident was then identified about a month later as diethylene glycol. I'll come on to that more in the next slide, but this is just showing the importance of chemical surveillance systems. If there's surveillance systems in place, you can pick up these poisonings or chemical issues hopefully a lot earlier down the line. So you're looking at a couple of months before, rather than, when you have a number of hospitalizations and serious illness. And so, yeah, just to say, the expected agent was diethylene glycol. Diethylene glycol is usually found in things like antifreezes and can be particularly hazardous, for instance, if a child or even an adult drinks from an antifreeze bottle. But what's happened here is, because it's an alcohol, it was unfortunately used as instead of I think it was supposed to be a non-toxic product, but there was a substitute with diethylene glycol. But it's worth saying that firstly, people were just thinking about infectious disease. There wasn't any thought that this could be a chemical caused illness. And then an antihypertensive medication was suspected, i.e. a pharmaceutical cause. But then finally 2 patients realized that they both had some of this cough syrup, and they presented with it, and then it was suspected. And then diethylene glycol was found as a contaminant eventually in the production of pharmaceuticals, which is a colorless and odorless liquid and a human toxicant, unfortunately. Okay, so there's another question here, so I'll give you a minute or two. Apart from the scenarios we've already discussed, can you think of any other, common chemical incident scenarios? And if you could type your answers in the chat, that would be great. Hello, so I'm just going through the list now. So we've got chemical spills, methanol poisoning. Be interested to know what those chemical spills were with, if you're able to put that in. Textile factories, that's an interesting one. 200 litres of tar, that's an interesting one. I don't think I've come across that before. I see a phenol exposure there, so I'm guessing that's from lab exposure. And we'd always recommend, obviously reading an MSDS beforehand for using chemicals. And if there is advice wanted on a chemical, if you do have a poison center, you can call them for information-only purposes to ask about, what the toxicity of a particular chemical is if you don't have an MSDS or it has limited information. Leather industry, yes, we've come across some chemicals used in the leather industry before. Good point. Okay, so I'll move on in the interest of time. But again, some very good answers there. Pouring lamicals in the lab sink, yes, and yes, Sudan more unknown chemicals is a very good point. We've talked about accidental releases so far, but chemical releases can be deliberate. We can get, chemical warfare agents such as sulfur mustard, sarin, and the chemicals causing significant health effects and, a lot of concern for individuals in the area. Okay, again, thank you very much. There's been some really good answers there. And again, there'll be an opportunity at the end to discuss in a bit more detail. So next, I'm just going to look at, identifying the problems with chemicals. So there's a number of potential scenarios. I haven't got a lot of time to go into these in a lot of detail, but, it could come from environmental contamination. You can see at the bottom left there is an oil spill with the water on top of there. That can result in exposure to bathers, people using the water to swim, but also can contaminate fish, which can then contaminate the food chain. Environmental contamination can be in the air as well, or via food or even consumer products in some cases, as we showed with the diethylene glycol example in Panama. Also, it's health effects following known exposure. There's a photo there of a person who's had a nasty chemical, I think it was trichloroethylene, spilt on his leg, which caused a number of burns, then can result in absorption across the skin, and from a toxicology perspective, cause CNS depression, cardiac problems as it causes systemic toxicity. And another problem sometimes you get health effects without knowing what the cause is, which can be very difficult instance to pick up, as with the Panama diethylene glycol example. And so they take specific ways to deal with that. Okie doke. So next slide is, continuing on, just to say the chemicals released into the environment may cause further contamination, whether direct or indirect, whether individual. And the public health impact of this will depend on the toxicity of the chemical. For instance, if you go into the middle of a shopping center or the middle of a area of a city and you drop a load of washing up liquid, you could drink 2 tons of it, and there'd be a lot of bubbles and people might be a bit annoyed, but it wouldn't actually cause any particular health effects. However, if it was something very toxic, something like a VX or sulfur mustard, you'd only need perhaps a matter of milligrams to be released for it to cause health effects and even significant casualties. So toxicity is obviously very important. The time period and route of exposure, because when things are inhaled, they generally you generally get symptoms more quickly. If you think of if you're breathing chlorine in a room, you'll get symptoms immediately. You'll get coughing, spluttering, and corrosive effects. And also, when you ingest something, it usually occurs more quickly as well. If you ingest a chemical like sodium hypochlorite, it goes into the system quite quickly. Probably won't happen as quickly as symptoms by inhalation, but can still occur rapidly. Whereas symptoms following dermal contact can be delayed, sometimes for a few hours, depending on the physical chemical properties, how it absorbs across the skin and into the bloodstream. Physical chemical properties are also important. If chemicals are volatile, for instance, they'll be more likely to be breathed in via air. Some chemicals will have a high vapor density, which will mean they'll accumulate in low-lying areas. That can then be a problem in outdoor areas if people are in those areas. Whereas if something is very volatile, so something like cyanide, hydrogen cyanide, for instance, if you mix potassium cyanide with water, it gives off hydrogen cyanide, but in an outdoor area, it will disperse very rapidly. So if no one's in the very near vicinity, you might not get symptoms for a little while. Degradation properties, what does the chemical turn into? In some cases, not often, but in some cases, chemicals can become something more toxic in the environment as they degrade. And the presence of a protective environmental mediator, for instance, whether there's any buildings nearby, are people sheltering within a building, that can act as a shelter from contamination and any further issues there. And as part of a public health risk assessment, that can take this into account and prevent further exposures. And this next slide is showing, the process of a risk assessment, and they split up into 4 areas. Such as hazard identification. What is the chemical? Is it hazardous to humans? It's virtually impossible to do a public health risk assessment without knowing what the hazard is. If you can sometimes work backwards from people's symptoms, but that's a lot slower process. So in case of an incident, whether that's to do with waste or otherwise, you really need to know what the chemical is originally. Well, you then need to characterize the hazard, i.e. what properties does the chemical possess? Talked about physical chemical properties on the last slide, but what toxicological things does it have? Does it affect the heart? Does it affect the brain? Does it affect the skin? So that's important for hazard characterization. Exposure assessment there, again, very important. If go back to my example earlier, if you release something extremely toxic into a very rural area, which doesn't have many people there aren't people there to be exposed, it's not likely to be a problem. But obviously where the exposure occurs, whether that's indoor or outdoors, can also be an influence. And that all feeds into the risk assessment process. And then as part of characterization, what you would usually do if you have environmental monitoring data available, you compare that to established guidance values for chemicals. There's a number produced often by countries themselves or by WHO to identify chemicals of concern, to identify whether it's likely to pose a risk to health. So that's a little bit about risk assessment there. I'm just going to talk a little bit about prevention of chemical incidents. And these are examples of ways to reduce the likelihood of a chemical incident from occurring. There's a big explosion on the right there from this incident that happened in the UK, actually a large fire that probably could have been prepared if there was better could have been prevented if there was better legislation in place, if reducing the amount or safer alternative of chemicals was used. You know, where is an industry likely to be based? Obviously, if you base industry near a lot of residential properties, if an incident occurs, it's more likely to impact on public health, not just the people working there. You know, are technical controls in place? Are they adequate to control any issues? Is it like fire extinguishers on site? Are there appropriate antidotes in place if people are exposed to particularly toxic chemicals for which an antidote exists? And also, it's important to improve, to educate the public. That came up earlier. It's very important that people are educated on how to use chemicals, and if they're near a big chemical site, what they need to do in an emergency. If they hear a siren going, what do they need to do? Do they need to go indoors, shelter themselves, reduce their exposure? What do they need to do? Do they need to do any other protective protective actions, such as going to hospital or anything along those lines? And from it, as it came up earlier, from a waste perspective, people, lots of members of the public might not even be aware that pouring waste down the drain could cause environmental or health impacts further down the line. So it's all about improving that as a part of chemical preparedness. These are some of the things we have supported in a number of African countries, and we advocate for, creating a risk register of dangerous chemicals produced in a country, for instance, or even a risk register of dangerous sites which hold chemicals in large amounts. Say a big industrial site that holds a lot of chlorine or mercury, that if there's an incident, there could be a problem. Preparedness activities, a national hazards plan can be very helpful to deal with any incident, as long as it has, chemical specific section, because managing chemical incidents can be different to biological and radiological incidents, for instance. And in some cases, we'd always advocate for establishing a national chemical plan with stakeholders in the country who deal with chemicals, such as environmental agencies, poison centres, ministries of health. So everybody then knows what their role is during a chemical emergency, and they all have specific roles and responsibilities, which can also be tested by exercising in cases. And that then feeds into appropriate planning, mentioned on the previous slide around planning, where sites are going to be based, what legislation needs to be in place. And finally, being aware of databases on chemicals, their sites, transport routes and expertise. So tying in with the first point around risk registers, what chemicals are used in country, where are they? What happens if we have a big incident at one of those sites? What are the transport routes and what expertise is involved? Another thing to think about then is preparedness, communication, emergency response guidelines, having appropriate communication procedures in place, emergency response guidelines to help people working on industrial sites, or even for emergency responders, so they know what to do in an incident. So thinking about fire, police, ambulance. Practice, and I mentioned exercise, and again, practicing, use of these plans to see how they can be, exercised in a proper scenario. And then finally, chemical incident surveillance, which I brought up briefly. It's very important to pick up on any chemical issues quickly, so that things can be, so public health agencies can take actions, or even emergency responders. Okay, I've talked for a little while now, and we're coming towards the end of the presentation. So this is just a very quick slide showing what, some of the pillars of Africa CDC and how chemicals might fit into that. Obviously, we've talked about chemical surveillance already. We've done a lot of work with regards to developing surveillance strategies, in trying to improve capacity of labs and poison centers to help pick up those chemical surveillance issues. Information systems are obviously important as part of that, of any surveillance system. We've done some work around, chemical laboratory surveys. There's been a number of surveys done in the past, but quite often chemical laboratories haven't been included in those. So we've done a lot of work with individual countries on, taking forward laboratory systems. And, most of what I've been talking about today is a lot been to do with emergency preparedness and response to waste or other issues. And, other missions is strengthening, national public health institutes and research. We work a lot with national public health institutes at present with regards to chemicals. And final one, disease control and prevention. I think this, is mostly related to infectious disease, which obviously isn't our remit. But if you consider disease as environmental pollution and issues, that's another thing to consider there. So that brings us to the end of the session. This session, I hope you found it useful so far. There'll be an opportunity for questions shortly. But just to say, our next session, which is in a couple of weeks' time, I believe, is on the detection for chemical hazards in public health, looking at chemical surveillance, analysis, and poisons information in a bit more detail. And again, this is going to be looking at methods and capacities for analysis and detection of chemicals, common surveillance methods for identification of chemical issues of potential public health concern. Also introduce the role of poisons information centres and how they're important for both detecting and responding to chemical events. Okay, Doug, thanks very much for your time today. We have a number of minutes. I think we've got a fair bit of time left for some questions, but please feel free to type questions in the chat or put your hand up, and I think Nafi can.
Sure.
Yeah.
Thanks a lot, Nick. Very engaging presentation, and thank you everyone for also actively participating in the chat. A lot of interesting questions and discussions that are actually already ongoing. We will take a few questions that are coming through, and maybe I can even pick up from the one that is actually at the bottom of the list here. The presentation started with really capturing what kind of chemicals are out there. We looked at what are some of the challenges that we are facing. A lot of them, I think we would be very interested in going back into the chart and seeing exactly what is happening out there. Nick, you'd realize one of the most common chemicals that was being mentioned there is the GTC. It's the guanidine thiocyanate, used much in the labs for molecular testing. And the question that has been raised there is, despite over 10 years of testing, we have not really managed to be able to report any incidents that are coming through there. What could be the challenges that you have seen? Where are people not really aware of the challenges that are there, or there are no mechanisms to report incidences or near incidences? Maybe we could start from there. Nick.
Yeah, thanks, Anafi. It's a very good point around, having the mechanisms in place to, report these issues, whether that's in the laboratory or, via, healthcare facilities or anything along those lines. And Lydia will be talking about it more in the next thing, but it all feeds into that idea of surveillance. It's like, what systems are in place? If somebody goes to their doctor with an unusual poisoning or chemical exposure, where does that information go? If you have a poison center in place, your poison center can be called by members of the public or or healthcare facilities to pick it up. Again, if something's picked up by laboratories, if a test of the blood or the environment, if they pick up that information, that can be there. So obviously, I can't answer this for every country in one answer, but we quite often go with, when we're working with countries, we usually pull together a lot of their stakeholders and form something called a chemicals technical working group, which has major experts from, environmental agencies, ministries of health, national public health institutions, and bring them all together so they can help, develop strategies and put these systems in place. Because I agree, and a lot of the time, these systems just aren't in place, and people are coming from a very low level to start with.
Great. Thanks a lot. Yeah, indeed. I think this goes back to also even previous sessions that we have done. It also goes to quality management systems within our labs. Do we have those mechanisms to capture such? I think we have also talked about biosafety and biosecurity. You spoke about risk assessments. When we do this, are we really doing enough? I see also comments like maybe we have not trained our staff enough on exposure. Particularly when it comes to chemicals. I know the time is going, but I wanted to take this opportunity to introduce one important team. Not that the other teams are not important, but this is our newly joined member of countries. The Botswana LabCoP team is formally joined the LabCoP, and I'm glad to say my colleagues are right there in Botswana right now with the team. So help me welcome colleagues from Botswana, and we look forward to working with them along the rest of the continent. Thanks a lot. Yeah, so going back to the questions, I wanted to pick one quick question that was raised by, I'm trying to find the name here. It was about fire extinguishers. They are quite an important bit in the labs most of the time, but when they are expired, so this is Nadia Jiwa who says, could these be added to chemical contaminants? I found this question quite interesting. Nick. You're on mute, Nick?
Yeah, no problem. Do you know what kind of, fire extinguishers we're talking about? Do you know what chemical they contain, or we just talk about normal foam? Or
unfortunately, that was not specified, but maybe you could just speak to...
Yeah, so I think
yeah,
it's a good question. I might need to look into it a bit afterwards. But yeah, most things found in fire extinguishers these days aren't particularly hazardous. And if a fire extinguisher has expired, I think that it might not work as well as it did previously, but it's unlikely to turn into something particularly toxic. Although I can give an example from the UK where something called PFOS was used to do the fire I showed earlier, the big explosion. That was actually the Buncefield incident. In that incident, we run out of firefighting foam. The fire brigade did, so they had to use some old stores which had something called PFOS in it, which was a persistent organic pollutant, and that ended up, contaminating the water, the groundwater there quite significantly. So I think the main thing to check is if you haven't used if you check what the ingredient is, and just to ensure that old style fire extinguishers aren't being used, because they could cause contamination issues if used in a fire.
Great. Thanks a lot. So there is one main challenge that happens in most of our labs, expired reagents. I know probably maybe today's topic is much more general in that, but it will be out of interest, like Tracy Mubambi has mentioned. How best can we deal with expired reagents in the labs? They are more largely chemicals.
Yes, I think again, it's difficult to apply this to the whole of Africa, but I think from our experience, and I'll let Lydia or Sean jump in if they have any thoughts. But yeah, from our experience, get lab reagents, they build up, they're expired, and then they just tend to be stored and left there. Like in an ideal situation, it should be like nearby facilities to help process those, whether it's a hazardous waste landfill or not. And I think one of the big gaps we've come across is the lack of specialist contractors, or if there are specialist contractors to dispose of that waste, them being very high expense and people can't afford to get rid of the reagents. So they seem to be the main ones we come across. But when I talked about the waste management tool earlier, as we develop that, we'd be hoping to get, wider stakeholder engagement to try and drill down to these kind of issues and see, what kind of solutions need to be in place. And if that means, getting a lot of evidence to say that, there's X number of labs in Africa which can't dispose of their regions, to highlight this and highlight to governments that maybe they need to encourage, the private industry to develop, that capacity to help remove it. It's not an easy answer, I don't think, but that's hopefully what we can do with, some of the work we're doing around waste.
Great. Thanks. I think that's very important, and a lot of us can relate to that. A lot of histology chemicals are there in not only histology. I think a lot of chemicals that have been mentioned in TB testing, even in general microbiology, they continue to be a challenge. We have reached the end of the hour. But certainly there are so many questions in the chat here that probably maybe we may need to do justice by going back to each of them and trying to answer them, and maybe share together with the package that we often share a couple of days after the session. On your screen right now is code for a certificate. You may want to check this after about 48 hours. I think this will be active in our ASLM resources page that has been shared in the chat. As usual, we will be able to share the slides with you, firstly, immediately after this session through our WhatsApp groups. Those that are in the WhatsApp groups are able to receive this. And then after about 48 hours, you should receive an email for all those that registered for this session. I would like to give Nick 30 seconds to give us some closing remarks to this session.
Okay, yeah, no, thanks very much. I just want to say thank you very much for the opportunity to present today. It's been really interesting, and it's been really good to see all the engagement, with all the comments in the chat. And this is seen as a very first step for us. We're hoping to work with Africa CDC more closely in the chemicals area. This is actually the first session we've given in the chemical area first training session through the chemicals area in Africa CDC. So, hopefully that can help highlight the issues around chemicals and hopefully lead to more collaboration going forward. And obviously we've got the next training session, which Lydia will be providing. But yeah, hopefully this is something we can build on, via Africa CDC and potentially helping out labs specifically through some specific work streams and things. Yeah.
Thanks a lot. And this session has been jointly co-hosted by ASLM and the Africa CDC and the UK security agents. Dr. Aitenu, do you have 30 seconds for any final remarks?
Thank you very much. I think Nick and ASLM team and Anafi. So we're happy, I think, addressing issues, what we have presented today. Chemical is a very challenging issue, so that I think we keep continuing to work together with UKHSA and ASLM and other partners, being able to really resolve an issues. And we extend also our support in terms of training aspect of these chemicals related, problems and the like. So we are happy to really open up these discussions today. Thank you so much from Africa CDC.
Thank you very much, Dr. Aitenu. Colleagues, it's been wonderful as usual. And on behalf of the ASLM team, the Africa CDC, and the UK Health Security Agency. Thank you very much, and till we meet next time. Goodbye.